I'm here at day 2 of the European School of Hematology meeting and to talk about future combination therapies in multiple myeloma. To date, the progress in myeloma has been related to combining the immunomodulatory drugs with the proteasome inhibitors, antibodies, and HDAC inhibitors. And in the future, there will be all entirely new classes of drugs that we can use in combinations. So for example, blocking the ubiquitin proteasome cascade will be possible not only with proteasome inhibitors, but with ubiquitin receptor inhibitors. Adding these two different blockers together can probably overcome proteasome inhibitor resistance. In terms of the immunomodulatory drugs, we can now overcome resistance to the immunomodulatory drugs by combining or combination strategies that restore cereblon levels and restore thereby sensitivity to IMiD combination treatments. In the antibody area, we have combinations already with the immunomodulatory drugs, lenalidomide with daratumumab, lenalidomide with elotuzumab, and pomalidomide with elotuzumab. But in the future, there will be even more exciting combination therapies. The antibodies, the immunotoxins against BCMA will be also combined with the immunomodulatory drugs and proteasome inhibitors. CAR T cells are a big topic here, and in order to improve them, there are multiple strategies. For example, targeting combinations of antigens using what's called the SynNotch vector, which binds to one antigen, and only if it binds to a second antigen does it turn on the CAR. So that's a combination target approach. Expanding CAR T cells in the presence of a PI3 kinase inhibitor to, in so doing, enrich for memory T cells is a combination expansion approach. And then to try to prevent exhaustion of CAR T cells, strategies such as immunomodulatory drugs or checkpoint inhibitors would be considered. Finally, vaccination in combination with adoptive therapy. The idea that you could vaccinate patients against a BCMA peptide, generate memory T cells, harvest those T cells after vaccination and expand them, reinfuse them as the patient's own immune army against BCMA, and then as needed, vaccinate them subsequently to maintain those cells. Finally, genetic strategies in myeloma already are combinations. Described here is venetoclax and bortezomib. In the future, there will be the so-called MyDrug clinical trial based on genomic profiling, where particular genetic abnormalities will be targeted, combined with pomalidomide and ixazomib state-of-the-art therapy. Finally, epigenetic therapies have been described here, and again, they're first-in-class agents, and they will be used in combination. Most importantly, we can achieve minimal residual disease in multiple myeloma with targeted approaches at present. We need not only to do that, we need to use combinations with immune strategies if we're going to achieve long-term disease-free survival and cure. And many of the strategies here will combine not only targeted agents, but targeted and immune agents with that goal.